let me just show you this first. When you open your kit, you're gonna have, this is a Castile soap, which is just a kind of a gentle soap. So if they ask for a soap suds enema, then you mix this with the water. You don't actually get suds though. You just kind of move it back and forth. I don't know if she talked about that at all. But then here's a little protector for the bed. And this, the plastic side goes down so that if there's water, it absorbs on the top, it doesn't go down to the bed. This is not really all that much for you to use, so you might want to have something bigger too. But this is the bag, and actually I want you to try using the bag because it's good for you to figure out how to fill it up. You go on the top, and then you just kind of squeeze it together, and then it makes the opening so you can get the water in. But before you put the water in, make sure you shut the clamp off, because otherwise you're going to put the water in and it's going to be coming out. So I usually move that. Yeah, you guys have one.
It's all within the
I
tubing.
put this
NG stuff.
Oxygen mask.
up here and then slide that across so that you shut it off. Now I put it up high because you don't want it down right by the rectal area because it gets in the way. And then you have a tip. This one is pre-lubricated, but to be honest with you, I would usually bring a little extra lubricant and just put a little on some, like some Kleenex or something so that you have it, because that's not a whole lot of lubricant. Some kits will come with a little container of lubricant instead. Now, when I go to put the water in, I put the water in about 99, 100, 102, somewhere in there, just a little above body temperature. You don't actually have to measure it unless your policy at your procedure at your place says. But otherwise, just kind of feel it. So you want it to be a little bit warmer than your skin. So the amounts are on the side over here: 500, 1,000, 1,500. If you have to have something real exacting and you can't figure it out, you can use a graduate and then pour it in. But most of them, they'll just go by those kinds of markings. Okay, so that's the equipment. All right, so we'll start the skill then by, I will wash my hands and I will gather my equipment. So I'm outside the room. I'll just stay here, but I'm outside the room. Gather my equipment, gloves, probably another pad would be nice also for the bed because this is so small. I'm gonna look at my order, figure out how much fluid I need. Is it soap suds? Is it water? Get that all situated. So I will actually fill up the bag out there before I come in so that I can bring it in and it already has everything in it. I have a card or some sort of something that will have the patient's name and such so that I know I'm giving it to the right person. So knock on the door, come in and say, hi, my name is Sandy, I'm the nurse today and I'm going to be giving you an enema. Could you tell me your name and your birth date? I can look at their name tag, and then I can actually look at the person's, the order or wherever I've got all that information. Okay, so I make sure I have the right patient. I'm going to ask them if they've ever had one before. If they haven't, I'm going to let them know what I'm going to be doing, but otherwise we'll say that they've had one before. So just sit things down here. I'm going to hang this on here. Now if you don't have an IV pole, it's fine. You can lay this down, it won't spill out because there's like a little valve on it. I'm gonna take my, I'm gonna take and put out the bedpan and the toilet paper so it's closed at hand. They stole my toilet paper. Now you can use, you don't have to cover them up with a blanket if you want to just use your bedding, that's fine. But I'm going to want to position the bed, and so I want to put it up to a working level, and then I'm going to put the side rail up on the other side. Okay, I'm not going to though because then you can see better. Okay, I'm going to tell the person I'm going to have them turn over onto their left side, bringing their top leg forward. So I'm going to uncover them so you can see what it's doing. So bring their top leg more forward, and then make sure that they're comfortable like that. And then what I would do is I would have this covering them and just uncover the buttocks, okay? But I'll keep it down so you can see it. I know, it's like new skin. Again, the plastic area will go down, and many times you will need more than just this one. Now, if I have lubricant that I wanted to put extra on, like I said, I can have it just squirt it onto a piece of tissue, or I can even just push squirt a little bit here on the edge, so. Bring in my equipment close. This can be about, they say 12 to 18 inches above the anal area, so at this point, we're not really even above it, but I can adjust that later. Now, when I have this filled, there's probably still air in this tube. So what I can do is open this up and run the fluid through. And you can usually just do that when you're watching, and try this stuff again so that you can see how it works. But as I bring this up, it's not gonna flow out. And then as I bring it down, it's gonna start to fill the tube until I get to the same level that the water's in. I could have done that before I came in, I've forgotten, so I did it now. Just always make sure it's done before you insert it, because otherwise you get a bunch of air into the rectal area, and it's hard for the client to make more cramps. So I'm gonna let them know that I'm gonna insert this to their buttocks, and that I want them to just take some slow breaths through their mouth. So I can just kind of separate the cheeks a little bit, and then I'll insert this. If I don't have enough lubricant, then like I said, I could have just taken it from here. And I'm gonna put it in about a couple of inches, and then I use this hand to hold it in place, just so that way it doesn't go in or out, just right there. Okay, now what I do with this is I use this clamp to just go on or off. And then I do all the controlling by raising or lowering the bag. You're not gonna be able to adjust it like an IV with that clamp. So when I hold it higher, it's gonna flow in. When I put it down, it's gonna stop, or else if I put it way down, it actually flows out. So I'm gonna tell them that I'm gonna start the enema and to just take some slow, deep breaths, and that if they have any cramping, to let me know. So hold it up here first. Just say, okay, are you doing okay? They say, yeah, so it's going in, and they might say, oh, it's cramping. So I'll lower the bag and I'll say, okay, just take some slow breaths. I'm gonna stop it for a minute here, just take some slow breaths, okay? And then, again, you can start it up. So you're paying attention to that, make sure that they're doing okay. So now, once everything is in, I'm gonna just hold that up there, shut it off. Now I'm gonna ask them to just take some breaths while I take this out, and then when you take it out, kind of hold their cheeks together for a minute, because it has that natural urge to go together. Okay, so now, depending on, I really don't like hooking these on here, because this is dirty, but you may not, it might have to be reused again, so you might have to save it, so.
So you wouldn't get a new bag for
You don't,
each time?
it depends. This one you probably should, but it depends on your facility. If it is garbage, then just you can, and that's fine.
Sandy, when you pull it out and, you know, like have that massive urge, can you tell them to like, try to squeeze, try not
Yep.
to release anything?
Yep, if you wanna try to hold on as long as you can, yep, that's all fine. Okay, so then, this one, you know, my hands are probably kinda dirty, so I'm gonna take those gloves off. If you wanna put on a new pair, you can. You don't have to have gloves on to put the bedpan under, but you do when you take it out. So, I'm gonna have this really close at hand, and I can put this underneath them. I tell them, I want you to hold on, hold that as long as you can. If the person is able to go out to the bathroom, then that's fine. I just want to put their slippers and stuff close by, but we'll pretend that they can't.
Now,
Okay?
would you put the head of the bed up?
Yeah, I'm gonna put the head of the bed up, and I'm gonna put the bed down low. So I'm just gonna pretend it's down low. Now the head is up. I'm going to give them the toilet paper. I want you to call when you're done, or if you have any dizziness or lightheadedness, here's your call light. And then I can step out. So I've got the bed's down, it's up, they're positioned. Call light comes on, I'll come back and say, were you able to wipe? And they say yes, we could, that's fine. I'm gonna put gloves on to take out the bedpan. Gonna put the head down, raise the bed back up, and then just like you do your bedpan skill, turn them up to the side, take this out, and if I needed to help them wipe, I could do that, but we'll pretend that they wiped everything themselves. So, take off my gloves if I want, and cover them up, call lights in place, bed's low, they're all safe, they're fine, they're doing good, and then I can go to the bathroom, put gloves on, clean that out, and put it all away. Chart what I gave them, so 1,000 milliliters tap water enema, tolerated with minimal cramping, expelled, large soft brown stool with brown liquid, something like that, okay? so that's basically it. Now, if they can get out and go to the bathroom, be sure to help them, because a lot of times people can get real dizzy because you're stimulating the vagus nerve that's in the rectum, and so that can slow your heart rate down and make you dizzy, drops your blood pressure, and so it can be a safety thing. So you want to help them. But if they go to the bathroom and you leave them alone in the bathroom, call light, tell them to call if they get dizzy, and tell them not to flush the toilet, because you want to be able to document what kind of results they have. In the bedpan, it's easy because you get to see. Yeah.
When they're, that was a question I had earlier, after they've released and used the restroom and we check what is left there, are they supposed to wipe and leave their toilet paper in there as well? Like, how do you do that?
Yeah, they can.
Okay.
You know, you want to be able to see,
Right.
but it's not as bad about, like, we're not trying to get unless you had to get a sample of something, then you might want them to put it in the garbage and then
Okay.
get rid of the garbage. But otherwise, yeah, they can.